Hello. How's everyone going today? So, as promised, I am doing a little bit of a Facebook Live series and I'm going to be focusing on body signs. Um, Body signs, I love body signs. First of all, for those of you that you don't know me, my name's Naomi Judge. I'm a naturopath and nutritionist, and I focus in women's health and hormones. And one of the areas I focus on, I'm particularly passionate about, and I absolutely love, are actually looking at body signs. So as well as symptoms, but actually looking at body signs and trying to pinpoint, what is going on internally, what's going on with the diet, what's going on with the lifestyle that's causing this kind of body sign to appear. So it could be anything from certain types of acne, to hair loss, to rashes, to hives, to fat distribution, cellulite, teeth problems, puffiness under the eyes, premature aging, that kind of thing. So there are so many body signs, but it's really exciting because when you start connecting the dots and really diving deep, you can actually have a look at what might be causing this, what's going on in the diet, what might be going on in the health, because it's our body calling out, it's our body sending us a message saying, hey, look, something's not quite right. That's when we need to do something about it. And if you start actually looking at the body signs in that way and actually trying to remedy them, then that's how you're going to actually reach your optimal health and actually get to the root cause and help to uncover the root cause and also help to nourish and clear up the root cause. So that's why I love it. And I love it because I see so many patterns. And this is one of the reasons that I love body signs so much. Over the years, seeing hundreds and hundreds of women with hormonal problems, genetic anomalies like MTHFR, pyrroles, insulin resistance, elevated estrogen, low progesterone, elevated testosterone, you kind of see a pattern. And that's where it's wonderful, just looking at these patterns throughout life, looking at what these people have got in common and really understanding then where it stems from, and then we know what we can do about it. So this is a Q&A, but I've actually already got some questions. So I'm going to get started on a few today, and then what I'll do is over the next couple of sessions, I will do some more, get some more. So today, I'm going to focus in on skin. I've got a few skinny ones here, so let's focus in kind of like on skin and maybe ENT, kind of like that kind of thing, because I've got a few questions here, and I'll look at my my other questions here as well. I've got a kind of a whole load, but let's just focus in. If there's anything in particular that interests you. Oh, hi Kasha, how are you? I think I've got a question from you here. Nails. So nails, let's start with that as you've just joined, yay. I look a bit washed out in this. I think it's like the bright sun. It's either that or the colour of my top. I'm not quite sure why I'm kind of looking a bit washed out, but hey ho, there we go. As long as you can hear me fine, that's all right. Okay, so Keisha, you asked nail ridges and splitting. Nails are amazing because they tell us so much about a person's health. It's really exciting to look at nails, and really it can uncover what's going on. Now, the issue with body signs is certain body signs can mean different things with different people, and they're expressing themselves in a different way. No, they're expressing themselves, in the same way. So, for instance, ridges on the nails. Ridges on the nails can mean a couple of different things. So what you have to look at is what else is going on with a person. So if we've got ridges on the nails, on all the nails including the thumb, we could be looking at mineral deficiency, we could be looking at B12 deficiency, and sometimes we're looking at iron deficiency. Splitting down rather than across, so down. Oh, okay, so we'll get, splitting down the nail. So when it's splitting, so those are ridges happening down the nail. Also, ridges can happen due to damage, so cuticle damage. If you get your nails, if you go to a beauty salon a lot and they can sometimes damage the cuticle, that can also cause the ridges. But if it's splitting as well and the nail's dry, then what we're looking at is lack of minerals such as vitamin D, we're looking at calcium, we're looking at oils for the nail. So it's more of a mineral deficiency. I've actually found that, this is anecdotal, I haven't done any study or haven't seen any clinical trials, but with splitting of the nails, I found that when people take apple cider vinegar, in the morning in a little bit of water, it actually clears up the nail. It actually stops it from splitting because it helps with the absorption of nutrients. But if your nail's splitting, it's more dry. If it's flaky, so flaky at the end, you know, it kind of flakes off like that, then it's soft. That can often mean low calcium and again low iron. But the splitting of the nail is more dry. It's due, you know, oils in the diet, fish oil in the diet, not enough of omega-3 in the diet. Krill oil is very good as well, and vitamin A is very good. So it's fat soluble vitamins like your A, your vitamin E, your vitamin D, and I'm missing one there, and your omega-3s. So they're very important for splitting nails. I would do the apple cider vinegar for a little bit of time. Do 6 weeks, Kasia, on the apple cider vinegar in the morning, because the apple cider vinegar, as well as having the probiotic goodness, and it's actually got more minerals than the lemon because it's got the mother, which has got lots of nice minerals in. It actually, I have found with my clients, when they start doing the apple cider vinegar, the 2 things they notice first, or the 3 things they notice: 1, digestion starts to clear up; 2, their hair starts to look better; and 3, their nails start to look better. So that would make you come to the assumption that the apple cider vinegar is somehow helping with the assimilation of this calcium, the iron, the manganese, the magnesium, which goes to make the nails, and that helps. When we talked about the fat soluble vitamins, did I talk about vitamin D? It's very important. So if you're low vitamin D, you'll get the splitting nails as well. So I would just check, Kasia, that all the fat soluble vitamins, you're getting those in your diet, and then do the apple cider vinegar and actually see how that goes. But when it's the dry, you know, it's the dryness. Another mineral that's really important for nails is zinc. So if you've got any white spots on the nails, coupled with any hair loss or splitting nails, you might want to look at the zinc as well. Yeah, stop with the lemon for now and do the apple cider vinegar in the morning, and just see how that goes. So that will work nicely. With the nail ridges, if it's just ridges and there's no splitting, it could be low iron, but also digestion. So H. pylori bacteria, and a bacteria in the stomach, can actually show itself in ridging of the nails. So what I found with clients that have H. pylori, they will have ridging, especially on the thumbnail. So if you've got heavy duty ridging on the thumbnail, coupled with any bad breath, coupled with any digestive issues in the stomach, heartburn, or any pain in the stomach, bad breath, or white tongue or anything like that, coupled with a ridging on the thumb, then it most likely will be actually the bacteria in the stomach. Okay, I hope she gets better soon. No problem. Bye. That's nice. Oh, lots of sick kids around at the moment. So if the ridging is on the thumb, you need to be wary of that. Then we've got white marks. So white marks on the nails, it can be trauma. So look out for that if you do a lot with your hands and everything. It can be trauma. But also with white marks on the nails, it can be low zinc. So there are 2 schools of thought: low calcium, low zinc. But low zinc, I found when you give people zinc, their nails clear up quite quickly. And this is quite interesting. I've seen this, and because it's, you know, you watch out for things, and I know with myself, it's very, when you look at yourself, you can actually start to learn so much about what goes on in the body. But I know for me, when they do, I live near a golf course and gardens, and when they do the spray, because I see the little signs go up, I actually get, this is really interesting, I get the white marks on my nails. So what I'm assuming is happening is, because of the pesticide, the spray that's being sprayed, my body's having to utilize more zinc to help cleanse and detox that. So in that period of time, I actually get low in zinc. It's really interesting, and I haven't got any at the moment, but I've had them twice, and it's actually paralleled the same time as they've done the spray and everything. So if you've got the white marks, have a look at your environment and maybe start eating foods with zinc in, you know, like oysters, pumpkin seeds, or you can even supplement with zinc. And what you'd hope would go, you know, the white mark grows out and then you don't get any more white marks. You don't want them to keep coming back. So that's what could be going on there. Sometimes it could be, you know, calcium deposit. And so you want to look at your vitamin D. So just have a look at any other signs you might have if you have any vitamin D deficiency signs. But when calcium deposits in places it's not meant to deposit, like cysts, calcifications, white marks, any other bony bits and pieces, bone spurs, anything like that in the feet, when calcium's not doing what it's supposed to be doing, vitamin D deficiency is normally the key to that. So just see if if you've got any issues with that, have a look at that. Anything else with nails? So when nails spoon, often that means iron deficiency. When they're soft, we're looking at low iron. When they're very pale, we're looking at low iron, or we're looking at not enough blood supply. And then we've got the moons in the nails. Now, the moons in the nails, there's no, if you look through all the literature, there's not a lot of clinical significance to moons in the nails. Moons are the little white things here. But we are meant to have the moons. And if they're too big, they say maybe our thyroid's working a little bit too hard. If they're too small, maybe we're not getting enough oxygen and it's hypothyroid. Now, I haven't done enough actual visuals of the moons, and I'm going to start doing it because this is the way I learn. I look at clients, I record what's going on with their body signs, then I have a look at their bloods, I actually have a look at their other symptoms, and actually have a look at what they've been diagnosed with by their practitioner, by their GP or by a surgeon. And so I'm going to actually start looking at that properly and just connecting. But what I'd be really interested to know is any of you out there with Hashimoto's or hypothyroid disease. I would love to know, do you have moons on all your hands, on your thumbs, and then your fingers? Do you have moons or no moons? And I'd love to know who out there, let me know. I have small moons on my thumb, and I have very little moons on my fingers. But I also know that I have a sluggish pituitary and a sluggish thyroid, just due to genetics. And also I was brought up in an area where they paid a lot, sprayed. I was brought up in the countryside around corn and wheat, so I know that wheat actually, so I know it was sprayed a lot with pesticides, so I know I've got issues with glyphosate, glyphosate, and my thyroid is sluggish and my pituitary is sluggish, so I know that might be the reason. But I'd be really interested to know actually. Let's start a new thread on that. So those are your nails. So we're really looking at digestion, we're looking at getting your omega-3s in, your fat-soluble vitamins, your D, your iron, and making sure your zinc's at a really good level as well to get really nice, beautiful nails. And nails and hair normally go hand in hand as well. So itchy, waxy ears, and I have talked about this in my blog post. Itchy, waxy ears fascinates me because it's not normal to have your ears syringed, and a lot of people have their ears syringed. And the first time I thought about this was a while ago. It was probably about 6 years ago. My partner, he had to have his ears syringed, and I just thought, oh, why does he have to? Our ears are meant to drain themselves, and there shouldn't be a problem. Sometimes they get sticky, and then you've got kids who have all the ENT things, their tonsils swell up and their ears get all blocked. So that fascinated me. And the more I asked my clients, I could see that what's going on is your whole ENT, your eyes, your nose, your sinuses, your mouth, your ears, connected to your stomach, connected to your vagina, connected to your anus. So it's all just one long bacterial kind of biome, as well as us, but they're all connected. So if you've got anything going on with the ears, itchy, blocked, waxy, you're looking at bacteria in the gut. So I'd really advise you to do really nice protocol with the gut, do some lots of probiotics, sauerkraut, really good probiotics. The LGG strain is good, rhamnosus is good. Go for lactobacilli, try and stay away from inflammatory probiotics just while you're doing this, and maybe take a couple a day along with sauerkraut. You could also do some kefir and maybe a little bit of kombucha if you know if it's a good brand of kombucha and it doesn't have any nasty bacteria in. So you'd start there. Then there are foods that would play up. So if it's sugar, gluten, dairy, that's wheat, soy and corn, also cause that kind of like stickiness and itchiness. So you might want to just clean out your diet a little bit and then work on the bacteria as well. And that should actually clean your ears up. We shouldn't need to be sticking things in our ears. We shouldn't need to be getting them syringed. And if we're having to, it's telling us that our body's just not doing something quite right. So let's do something about that. If you have smelly earwax, that's normally a yeast infection. So again, go to your gut and just sort out your diet. That's the best thing that you can do with your ears. So the gut, the bacterian, and maybe a food intolerance with my eyes itchy, sorry, with your ears. So that's your ears. And then talking about ears, we had another question about tinnitus, so ringing in the ears. Tinnitus is an interesting one, and it's, it can just be damage to the eardrum, to the ears, the little bones in the ears through loud music or your job. But also it can be down to mineral deficiencies, vitamin deficiencies, and the gut again. When anything's going on with the ears, remember, we look to the gut. So Meniere's disease, there are some schools of thought, that could be caused by some bacterial issues going on. So when there's anything to do with the ears, work on the gut. And if it's ringing as well, you may want to look at your B12 and your B vitamins. Ringing in the ear, it has been shown that ringing in the ears can be caused by low B12 and B vitamins. So you may want to do like a nice activated B12. Bioceuticals do a nice spray along with some methyl B vitamin supplements, because that will help as well. So you just want to do that. So work on the gut and make sure you haven't got any B supplement deficiency, and go from there. But that's with the ringing. Definitely with the ringing, you want to look at that. So that's the ears. And then I had a question about, so we're kind of doing this area, and we'll stick with that today so it's not too long. That's the ears. And then we had eyes. So I had a question about, I have red, itchy, swollen red eyelids around the eyes, and creams clear it up for a few hours and it comes back worse at night. It really looks horrible. When we look at eyes again, we look at the gut. But what I have found with eyes red and itchy is there's a real mold and yeast issue going on, and it can really be mold. So I would advise Kirsty to actually make sure if it's happening at night time, make sure there's no mold or any growth in your bedroom. Make sure there's no mold growth in your pillows, in your bedding, that kind of thing. Make sure that's all under control, because that can really flare the eyes up. You'll actually notice if you've got an issue with mold, yeasty things, bacteria, you'll get those itchy eyes at night. So really control your environment and just make sure you haven't got any mold in your environment. Optimoz do a product by Bulletproof, which is from the US. They do a soil-based probiotic spray that you can spray around the house, and it just helps control mold in your environment. And you can also get your environment tested. So I've forgotten the name of the lab, but I'll put that down. There is a lab in Melbourne. A wonderful guy runs a lab, and you can do air samples just to see if there's any mold growing in the air, and then work on it from that way. But normally, I'd be interested in knowing what foods actually, Kirsty, actually flare it up. Is it foods that have a lot of mold on, like your nuts and your seeds, grains, corn is full of mold, even some bad coffee. So have a look at if there's anything that might be flaring it up, and do you get any other symptoms along with that. But I would say it's definitely related to that, and we can have a look at that a little bit more. And then obviously the gut as well, so just make sure you're doing probiotics, and yeast and mold in food as well. Just be careful with yeast, I would. So that's the eyes, and then we're going to the mouth now. We'll just talk about the mouth because I've got this question. Okay, got a couple of questions about the mouth. I have my tongue. So tongue feels swollen, and also getting ulcers in the mouth. So whenever there's anything going on in the mouth, particularly ulcers, funny sensation in the mouth, or a swollen tongue, sometimes it can be hormone related, so high estrogen, so something's going on. But more often than not, it's actually a B vitamin deficiency, B12 in particular. So again, I would try the B12. Get your B12 tested in your bloods. You want it at a really good level, you want it above 500. So get your B12 tested. But also you may want to supplement with a B12 spray and some B vitamins. Give yourself a couple of weeks and see what happens. If that sensation is coupled with any depression, coupled with any tingling in the hands and feet, numbness, anything like that, then quite possibly it is a B12 deficiency. So just have a look at that and then go from there. We did, in my blog post, we have got one for dry lips here. I actually suffer from dry lips sometimes, and so I know what flares it up. So there are a few things that flare dry lips up, but lip balm doesn't. Lip balm actually kind of causes a problem just never to get resolved. So it's always my advice to actually go through that healing process with the lips and not to use any lip balm. So you can use lipstick occasionally, but you don't need to use lip balm daily. We shouldn't actually need to use lip balm. And if we have to use lip balm, then there's something going on with the lips. So sometimes it can be low progesterone, because low progesterone causes proliferation of tissues. And so low progesterone, so you might find that your lips flare up cyclically, either before menstruation or around ovulation. So have a look at that. So it can be a hormonal issue. If it's flaking with no itchiness or pain or anything like that, or not too much dryness, it can be zinc deficiency. So if you have the flaking lips coupled with dry skin, coupled with, say, acne, or coupled with dandruff, that kind of thing, it can be low zinc. So that's one to look out for. And then another one I was going to mention, again, gut problems with the lips. So if you've got any bacteria in the gut, like H. pylori or other bacteria, strep or staph in the gut, particularly in the stomach, that can cause dry lips as well. So if you get stomach problems, or you have ridges on the nails, or you have a bad breath or anything, then it could be your lips. So my advice for the lips is, mouth breathing as well causes dry lips. My advice with the lips is, try not to lick them, try not to bite them. Don't wear any lip balm. When you go to bed at night, use micro pore tape, just to tape the lips here slightly shut, so you breathe through the nose. And it takes a little bit of practice. It takes about a week to figure out how to do that, but you'll have a really good night's sleep and your lips won't be dry anymore. So I would do that. That works really well. Okay, so we're sort of staying around this area. So then we've got hair. So hair loss. So any changes in the hair, you really want to look at thyroid. So if the hair changes from, it gets knotty, or if it's strawy or overly dry, you want to really focus in on the thyroid and see what's going on, because the thyroid, again, regulates metabolism, which can regulate skin and hair. So if you've had any changes in the hair, if there's any coarseness, if there's any dryness, any hair loss, look at the thyroid. Other things that can cause hair loss, low iron is a huge one. So really look at your iron. And some people just cannot absorb iron. They cannot, since they can't use it properly, absorb it. So you may need to take iron plus cofactors and really manage that. Really make sure you're getting a good iron level, because if your iron stays chronically low, it's going to cause all sorts of problems with growth in the immune system, inflammation, that kind of thing. So just be careful with that. So with hair loss, it can be iron. If the hair loss happens in particular areas, it can be hormones. So premature hair loss in men, I'm finding is actually related to elevated estrogen. Now, a lot of men are treated with DHT blockers for male pattern balding, but now over time, after doing hormone tests with men, I am noticing that DHT is perfectly fine, and it's actually high estrogen that's causing an issue. And so high estrogen to low progesterone can cause hair loss in men and in women. So don't assume, if something's happening, don't assume. I would actually get your hormones tested, particularly men, because if you're losing your hair because you've got high estrogen and you're taking a DHT blocker, which is a really powerful testosterone, and it's so good for your virility, and it's so good for longevity and your health. If you're taking a DHT blocker and it's the estrogen causing prostate cancer, or it's the estrogen causing hair loss, and it's just going to cause more problems. So you may just need zinc and selenium. So have a look, test your hormones. If you're a guy, and if you're a wife of a guy that's losing his hair and he's on medication for it, get him to test his DHT and actually make sure he's fixing the right problem, because it's really common that he's not fixing the right problem. So I would go there. And the same with women as well. If you're losing your hair, don't assume it's androgens. Get your hormones tested and then work out from there what's going on. Make sure you've got your zinc, make sure you've got your selenium, and make sure you've got your iron levels, nice optimal levels. Another thing with hair loss, so we talked about thyroid, low iron, low vitamin D, but another thing with hair loss is diet. So unfortunately, gluten intolerance, gluten sensitivity, gluten is in a lot of people an inflammatory food, and it can cause hair loss. So sometimes just tidying up your diet will actually remedy a lot of these issues. So always start with diet and then also get tested as well. So look at gluten. Gluten can cause hair loss a lot of the time. So there's a few things there to work on with hair, and I know that hair can be quite an emotional subject for a lot of people, but just take it slow and just go through one thing at a time. Do the diet, do the testing, do the minerals, and slowly, after layering it on and just being patient and being specific in what you're doing, you'll get to the root cause and remedy what's going on. I think that might be it for today. I'll just do one more skin. And this is bumps on the tops of my arms. Sometimes they are worse with others. One of my children has some worse. Okay, so bumps. Now, I don't know what the bumps look like, but I love this subject of the Kerstosis Pilaris on the backs of the arms. So with Kerstosis Pilaris on the backs of the arms, the couple of things you need to focus on. One is food sensitivity. So dairy and gluten in particular, can cause issues in your gut, so you can't actually absorb vitamin A and your B and your D, your fat soluble vitamins. So start with the diet and take the gluten, the wheat products out of the diet and see if that clears it up. Another thing is it might happen cyclically due to hormones. So high androgens and also high estrogen can flare up that inflammatory fat factor and cause Kerstosis pilaris. So that's like the chicken skin on the backs of the arms. So those are the main things I've seen. More recently, what I have noticed is insulin. So people that have had a life of insulin flooding the blood can cause all sorts of things like excessive moles, acne, skin tags, and also the Kerstosis pilaris. So insulin that's been in the tissue for too long, you've had a lifelong, you may be healthy now, but you used to have sugar all the time. It would have meant that insulin was being flooded into the body, into the blood, into the tissue, and that causes growth and it causes funny things going on in the skin. Acne, boils, fungal infections, hair loss, moles, freckles, melasma, Kerstosis pilaris, and skin tags. All those might indicate a blood sugar issue. So those kind of things, you want to regulate your diet, you want to regulate your blood sugar, take things like cinnamon, take things like zinc, maybe chromium, and then also have a nice diet that regulates your blood sugar, 3 meals a day with very little sugar, particularly in the morning. Have a savoury breakfast, and you should find that will also help as well. But there are a few things, like there's a lot of things that can cause that Kerstosis pilaris. They're just things that can contribute to it. But I would definitely start with diet and just use a really nice coconut oil, really nice moisturizer to trap in the moisture on the arms, on the backs of the arms there. One more skin question and then I will head off. So my next skin question was, my husband and I did the 3-day cleanse and we enjoyed it. He had a bit of a rash on his arm, which were red bumps that were itchy. He's had this before when he has junk food. Any idea what this means? So during the cleanse, if during a cleanse you come up with itchy bumps, especially if they've got a little bit of whiteness in the middle, we're looking at yeast and we're looking at fungal. We're looking at the gut, deep cleansing something out through the skin. So you just keep on going, do probiotics, maybe do some antimicrobials like a little bit of oregano. You could do 2 drops of oregano oil in water once a day just to cleanse out the system, and try not to have too much. Oh, hi Sandra. Did you have one? I think you had one, but I haven't got it written down. Nice to see you here. So we're looking at candida or yeast. So if you come up in funny rashes, especially during a cleanse, we're looking at candida and yeast coming out through the gut. So antimicrobials and lots of cleansing, and it should subside. It should go. So just keep pushing on that. Sometimes if things get worse before they get better, it's the body getting them out, and it's kind of what we call like a bit of a healing crisis. We really don't want to have a healing crisis, but sometimes if there's a lot going on in the gut, it will come out through the skin. So those are I'm just about to sneeze. Those are most of mine that I'm doing today, because that's quite a lot to get through. Hi, Veronica. So nice to see you. Sandra, I think you asked a question about the the tongue and ulcers, and I was saying that it's normally B12 deficiency. Some people have a sensation of a swollen tongue, and that can be a B12 deficiency. So I would actually just try the B12, and ulcers as well. Mouth ulcers can be B deficiency as well, and zinc. So just work with those first and see how you go. Some people say they get ulcers when they have a lot of sugar, and that can be candida. That can be the inflammatory factor from the sugar, the inflammation, or it can also be candida being fed by, or yeast or fungus actually being fed by the sugar. So you can just work it out if you've got any other symptoms as well. I hope you're well, Veronica. And Sandra, I hope you're well. And thanks, Kasia, for joining us. I know your daughter's a little sick, so you've had to pop off, but that was great. So I've got next time, I think I'm going to talk about some more thyroid symptoms, water retention, and a few other cool signs. There's a few others. Cellulite, I think cellulite, Sandra, I would get the B12 spray, the Bioceuticals one, the methyl B12. It's just one spray a day, and it just absorbs so well. Normal B12 supplements, it's really hard to absorb, but that one's a nice activated form, so it'll work super quick, really, really quick. And I'm also going to talk about cellulite, because there's so many questions on cellulite, so maybe we'll do a separate one for cellulite next time. So that's everything for today. That was a lot, wasn't it? That was quite a bit. Gosh, when you go into it. But I hope you enjoyed it. I hope you got lots out of it. And if there's any more questions, just pop them below. Do all of that. And so, okay, I'll see you all soon. Thanks for joining me. Thanks, Sandra. Thanks, Veronica. Oh, B12, Veronica, is we had a question about ulcers and about that sensation of a swollen tongue. The tongue's feeling too big for the mouth. So that was the B12, yeah. That was what the B12 is for. Low B12 is normally that. Coupled with tingling in the hands and feet sometimes, numbness, you can get low B12. So you may have had bloods recently, I think. I'm not sure if the B12 was on that. I can double check for you. Bye, everyone. Have a wonderful day and a wonderful week, and I'll see you next time. Bye-bye.